Welcome, everybody. Today we have Marily Garcia with us, and she's a licensed clinical social worker in New York State, and she specializes in working with adults and older adults through telehealth. So, Marily provides psychotherapy from her office using telehealth video conferencing for any client who's within New York State. So we're so glad to have her here with us so we can hear firsthand what it's like for a clinician to use telemental health. So thank you so much for being with us, Marily.
Oh, you're welcome, Ray. Thank you
And
for having me.
you're welcome. Let me show everybody your website. So this is Marily's website. You could find her here and find her services here. You can book an appointment by calling this phone number here. And if you have any questions, just reach out to Marily. Even if you're a clinician looking to get into telemental health. So yeah, Marily, so glad that you're providing telemental health, and I really look forward to hear about what your experience has been like. I know that a lot of clinicians probably watching this interview with you,
Hmm.
they probably have some concerns. They're probably like kind of eager to get started. They probably
Hmm.
have, reasons for that, like either they want to work from home part-time or
Hmm.
full-time or
Hmm.
want to reach more clients, stuff like that, but they're not quite sure what it's like to get started and what it's like to actually provide those services.
Okay.
So what was it like for you to get started in the beginning? Like what interested you in the first place? Did you have concerns? What was your excitement about? And how'd you move forward from there?
All right. So when I first started working in the clinical office providing therapy, I realized a lot of patients needed services out of the office where they couldn't make it. They were either sick or the snow would prevent them from coming into treatment.
Hmm.
So I started thinking, why don't agency provide this, allow us to have therapy from out of the office to our patients as an extension of services? So what I did is I got my LC. I researched training programs to really learn how to use the video conferencing via HIPAA compliant, because one of my fears was is using the wrong platform, and the not having the right encryption to be able to provide the effective protection that my clients need via video conferencing. So one of my supervisors emailed me the tele mental health training in New York City. I took advantage of that. I went to the 2-day training. I learned the ethical piece, the jurisdiction, the type of equipment I needed, the camera, the software. So it was a training that I received November about in telehealth that actually gave me more strength and power to be able to enable this, because I finally had the tools I needed to start my own outside private practice via video conferencing.
Wow, okay, very cool.
Hmm.
Yeah, and I presented that training, and it was a lot of
Hmm.
fun. I loved it.
It
Um,
was.
I know a lot of clinicians, well, sometimes after they take a training like that, like they learn all this information, how to do it right, and some take it and run with it,
Yeah.
and others don't. So what did it take for you? What resources or initiative did it take for you to actually take the training and actually implement it? Because you implemented it like
Very
snap.
quick. Yes, I didn't hesitate at all,
Yeah.
because I had already had a client, or I was servicing a client in the past, one of her kids, and the case was completed and she was outreaching for therapy, but she really didn't have time to go to the office as much because she has a couple of kids she has to take care of.
Uh-huh.
And she only had certain times in the home where she can have this therapy. And she was also mandated for services.
Uh,
So when I told her about the telehealth and what I was planning on doing, she was right on it. And she spoke with her worker, and let her know about the video conferencing. Of course, they had to interview me to make sure that it was HIPAA compliant and how it would work out to connect with them for
oh,
coordination of care.
uh-huh.
And since that day, I put everything together. I started working her for about 2 months now. She loves it.
Uh-huh.
Yeah, so she refers other people who I'm starting to get as my patients.
Yeah,
Uh,
that's great. And this organization that I guess she's mandated to receive counseling through, right?
yeah,
So now they know what you provide and what the care
yes,
coordination will look like and so
yes.
forth. Have you received any other referrals from them since then?
No, not yet. Because they still want to see how it goes with her for a certain
Uh-huh.
amount of time before they refer. But um, yeah. Hmm.
All right, perfect. Yeah, because that's definitely a great way to get started. So that's the way a lot of clinicians I find get started is
Hmm.
simply through their current clients. Once their current clients know that it's an option,
Hmm.
um, some of them will choose to do that because of convenience.
Yes.
Uh,
Yes.
yeah,
Hmm.
and then the word just kind of spreads. And now that
Hmm.
you are working with this one client, that organization knows, the client themselves are referring people.
Yes. Yes.
So that's great. Now you are in like the New York City area, right?
Yes. Yes, I am.
So there's tons of clinicians. You don't have to walk very far to find a clinician. But find it interesting that sometimes even people in like a metropolitan area like that with like a high density of clinicians, they still seek telemental health
Hmm.
because of the convenience, even when they have clinicians close by. It's really
Hmm.
interesting.
Hmm.
Um, so you just got started. What? It's been 2 months now.
It's been 2 months now. Yes. And also, I'm also working with eventually United Health, providing telehealth.
Okay.
I just finished putting my platform information. So I'm just waiting for that too as well.
Oh,
Um,
okay. Yeah,
and
I hear
EAP.
other people's and EAP.
Mm-hmm.
Okay. All
Yes.
right. Excellent. And this is a new contract with that you have with an EAP program,
Yes, it is. It is.
specifically doing telemental health.
Telemental health is my primary, but also going to the job if needed.
Ah, okay. Yeah, like crisis intervention kind of
Yes,
stuff.
crisis intervention. Hmm.
Yeah. Okay. Fantastic.
Hmm.
I heard of other people seem going to provide services, telemental health services for United Healthcare.
Hmm.
And there's a specific process to that, right? Specific application
Yes, you
process.
have to apply as a provider first with
Okay.
their network. And
And
then,
then there's an additional step, right?
yes, there's an option where it says if you want to provide telehealth, to check that off and to let them know which platform you're using to make sure it's HIPAA compliant.
Ah, okay.
Mhm.
Yep, fantastic. And you took my recommendations.
Yes, I
And
did. I
and
took
it's working well for you.
everything. It's
Yeah.
very, mhm.
And how has this been helpful for you? And so you initially you wanted to do this because your client had a need.
Yeah.
And you wanted to meet your client's need, and it obviously has worked out really well for her.
Hmm.
Um, so how has it helped you as is for yourself in your own practice?
It's helped me a lot in terms of being able to manage cases and monitoring the treatment plans and psychosocial versus working for an organization where you have to stop what you're doing, go to meetings, go into the field where you can just be in your office, focus on that patient at the time, type up your notes, review their treatment plan. So it gives more time for us as a clinician to be able to handle the case management aspect and to follow up on their services with other providers, which is usually lacking in a regular agency office. So it's very time convenient, and you get to structure it, in a manner where you can get your work done as well as service the client.
Hmm.
Um, yeah.
So are you're still working for you're still working for an organization and you do private practice?
No, I actually resigned. I enjoy the
Ah,
telemental health so
well,
much, and that I've decided to make it my full time.
well, that definitely made a shift for you then.
Yeah, it did. It did. It
Telemental
did.
health made a big shift for you career-wise. Wow. Okay. Yeah. Yeah, I'd be interested to hear like your care coordination that you have with this organization with this particular client, like
Hmm.
how that's going to happen. Are you going to connect with them through video conferencing, just send them the meeting link and get on
Hmm.
video with them, or is it just going to be over the phone? Are you going to send your records to them somehow?
Hmm. So as far as the contact with the service, the extended service provider for coordination of care, I would ask them what their preference is first.
Hmm.
If they want to do video, then I'll send them a video link, and I'll assist them how to access it.
Uh-huh.
Or the conference, because on the platform you can also conference people on a phone, which has been effective too. I've done that already with one of the workers. So
Ah,
it depends on what they want. That's way.
Neat, because I haven't used that feature. I ought to. The phone conference feature. I knew that it existed, but
It does. It
I
does.
never used it. That's great. Yeah, because you have
I'm
that
happy.
phone in option, right?
Yeah.
I guess you use it the same way because when you create the meeting, it creates both the video link and the phone link.
Yep.
Yeah,
Both.
excellent. So any advice to other clinicians who are wanting to make this change to benefit both the clients in need and their own practice?
Yes. One of the statements I want to leave you guys with is, I know sometimes you worry mostly about HIPAA compliant, how to get it started. It is nerve wracking, but if you actually, do your research, take the trainings, and get the tools that you need, um, that anxiety would ease a little more, because you'd have more power in terms of what's expected of us as a clinician and how we can service our clients. Because the hardest part is finding the right tools to put it together. But I always strenuously say this: training is always the best way. And since taking the training, it has enabled me to get my certificate to provide distant counseling, as well as the tools so I can provide therapy effectively for my patients, for them, and for to be in state compliance. So don't be scared. Just do what you have to do for your clients as well as yourself. And for me, it's been a life rewarding and change, and I would not change this for the world. And I love this. So,
That's great. Thank you
mhm,
very much, Marilyn. That's
mhm,
really helpful.
mhm,
Um, yeah. So I was going to say with those there's clinicians. As clinicians, we always have clients who have a struggle with coming into a session from time to time.
mhm.
Sometimes we never even hear about the struggle because they simply cancel their appointment or don't
Yeah,
show.
yeah. Mhm,
And we never heard, like, why did they cancel, why did they not show? And often it's because of transportation, they didn't have the time, it
mhm,
just simply wasn't convenient enough. Because going to psychotherapy, of course, the obstacles are, you have the cost and then the time,
mhm,
um, and then it could be weather or whatever, the hassle.
mhm.
So telemental health definitely assists with that.
Yeah.
So we all have, all of us have clients who struggle with those situations. Many clients don't have a problem with finding the time, getting into the session, but some do.
Mhm,
So those clinicians in New York State really ought to identify clinicians like you, Marilyn, so that when they have clients in that situation, they could offer services, offer you as a referral,
mhm,
rather than just saying, oh, they can't make it in, give them an appointment to another clinician that they have to
mhm.
travel to. What good is that going to be? Like, they can't do it because they can't get into the appointment, right? Because of
Mhm,
travel, because of
mhm,
transportation, time. Um, so I think all clinicians really ought to have, I guess, in their resources, at least a few solid clinicians who provide telemental health within their state, because the clinician only has to be with license in the state where the client is during the time of the session.
Yep.
So it's not hard to find some quality clinicians that provide telemental health within your state.
Mhm.
Um, so those clinicians that are kind of interested, but they're not going to do it, they can at least refer to a clinician like yourself that's providing those services. So thank you very much for what you do and for taking the time to share with us.
Mhm.
And we will have Marilyn's contact information in the details of this video. So thanks again.